Hello and welcome to RPIIT Academics. This is Milind working with RPIIT Technical and Medical Campus, Bastada, Karnal. In this video, I'm going to discuss about diabetes mellitus and symptoms associated with it. So let's get started. What is diabetes mellitus? Diabetes mellitus refers to a group of disorders that affect how your body uses blood sugar, that is glucose. Glucose is vital to your health because it's an important source of energy for the cells that make up your muscles and tissue. It's also your brain's main source of fuel. That means glucose is a fuel for our body. The underlying cause of diabetes varies by type, but no matter what type of diabetes you have, it can lead to excess sugar in your blood. Too much sugar in your blood can lead to serious health problems. Chronic diabetes conditions include type 1 diabetes and type 2 diabetes. Potentially reversible diabetes conditions include pre-diabetes and gestational diabetes. What is pre-diabetes? Pre-diabetes occurs when your blood sugar level are higher than normal but not high enough to be classified as diabetes. And pre-diabetes is often the precursor of diabetes unless appropriate measures are taken to prevent progression. Gestational diabetes occurs during pregnancy in women but may resolve after the baby is delivered. What are the symptoms of diabetes mellitus? Diabetes symptoms vary depending on how much your body sugar is elevated. Some people, especially those with pre-diabetes or type 2 diabetes, may sometimes not experience symptoms. In type 1 diabetes, symptoms tend to come on quickly and be more severe. Some of the signs and symptoms of type 1 and type 2 diabetes are increased thirst, frequent urination, extreme hunger, unexplained weight loss, presence of ketones in urine, which is known as ketoacidosis. Ketones, what are ketones? Ketones are the byproduct of the breakdown of muscles and fat that happen when there's not enough available insulin. Fatigue, irritability, blurred vision, slow healing sores, frequent infections such as gum or skin infection and vaginal infections in women. Type 1 diabetes can develop at any age, though it often appears during childhood or adolescence. Type 2 diabetes, the more common type, can develop at any age, though it's more common in people older than 40. So that's all about diabetes mellitus, pre-diabetes and gestational diabetes and symptoms of any kind of diabetes. I hope you like this video. Please subscribe our YouTube channel RPIIT Academics.